My name is Naomi Longworth. I am currently a corrections nurse in Maine. I graduated last year and I love my job.
Hi, my name is Sandra Lopez. I'm a registered nurse in the state of New Jersey for an outpatient surgical center. I've been a nurse and employed at this facility for 3 years, currently responsible for the supervision of the nurses and medical assistants that work there.
Hello, my name is Crystal Johnson. I live in Traverse City, Michigan, and I work at Munson Medical Center, and I work in the endocrinology and metabolism department. I am responsible for the clinical data reporting portion of this presentation.
My name is Debbie Johnson. I'm an RN in Ridgewood, New Jersey at a 251-bed acute care hospital. I was working as a cardiac step-down nurse for 10 years, and recently I'm now working in endoscopy.
The Meaningful Use program was designed by the government's Health and Human Services to facilitate the adoption of electronic health records and use them meaningfully to complete a set of objectives. If eligible providers meet these objectives, they could qualify for incentive programs that would help fund the expense of electronic health records. Meaningful Use intends to analyze the data collected so that we may have better patient outcomes and more evidence-based nursing, which could lead to better patient care.
Meaningful use is a regulation put in place by the federal government which requires hospitals and other healthcare organizations to use health information technology meaningfully. This is done by adapting electronic health records which are up to date and have superb capabilities. The incentives program was started in 2011 and has already been released in stage 1 and stage 2. And stage 3 for the incentives program is to be met by all providers and healthcare organizations by 2018.
Our patients are our #1 priority. Implementing quality programs such as public health reporting can improve overall health for all. In order to meet these goals of the Meaningful Use program, we must embark in the 3-stage process, which includes collecting data from physicians via their patients and having them report that data back. The second stage includes exchanging that information via electronic means, which allows for a better coordinated patient care throughout the various physicians caring for that one patient. The third stage, which is currently in place, is to improve patient health outcomes, and this will fall into place by implementing the first 2 stages into practice.
And Deb?
So as you can see, by going electronic, not just in a single hospital or doctor's office, but having all those offices interconnecting with each other, these advantages will be met. Improving care coordination, real-time data, better communication with other clinicians, giving patients greater access to their own health records, reducing duplication, and patient safety and improved quality of care.
There are 8 advanced meaningful use objectives in stage 3. The proposed objectives include protect patient health information, electronic prescribing, clinical decision support, computerized provider order entry, patient electronic access to health information, coordination of care through patient engagement, health information exchange, and public health reporting. And this is what we chose to do our presentation on, is Objective 8, public health reporting.
So public health reporting is actually so much more. You can see that it looks at outbreaks, epidemics, prevention and cure, immunizations, and the data we collect will help with monitoring outbreaks, analyzing causes, and researching cures. This objective, we soon discovered, is quite involved. It is made up of 6 qualifying measures. For Stage 3, which is due in 2018, eligible professionals, EPs, must report on 3 out of these 6 measures by 2018. And eligible hospital and critical access hospitals must report on 4 of these measures. We will look at them one by one.
There are some exclusions to meaningful use. If a provider doesn't administer immunization, they are excluded from that meaningful use goal. Also, if the public health agency can't receive the information from the provider, then the provider is excluded from having to meet these goals.
The goal of this presentation is to look at strategies a hospital can take to achieve these goals. Let's begin. We will now look at measure number 1, which is immunization registry reporting. I think the first thing is to help a provider understand the benefits of participating in an immunization information system. In a small medical practice, understanding how this measure will help is key to making a difference. Nurses often did this work manually, and not only does it provide safer, more complete care to patients, it saves time and money, something a physician is always looking to do. Some ideas on how to generate compliance are incentives, such as a report card type system, like Hospital Compare. Patients could choose a provider based on some of this information. One simple way is for the state to provide compatible software for easy upload to the state's immunization system.
Now let's take a look at syndromic surveillance. Syndromic surveillance looks at general health of a community and breaks down the likelihood of an outbreak. Several of the pieces of information that are looked at include absenteeism, ICD-9 codes, and ER visits. There is a formula that works in the background computing the likeliness that a fever coupled with 2 days called out of work and a possible ER visit might indicate the flu. The great thing about this type of surveillance is that it is just looking at raw data and coming up with an algorithm that states a probability of an outbreak. This is all done on a continuing basis, and it spits out information before lab results are back. There must be an interface that red flags certain symptom combinations like high fever with a high pulse and ER visit. You can't take out the specialization of having a set of eyes on the patient, so sometimes before the numbers are crunched, a doctor or nurse could already be on the phone with a suspect of disease process. Specialized registry case reporting. The purpose of a specialized registry is to monitor certain diseases and/or events important for the health of the community. These include birth, death, and chronic illnesses such as HIV, Hep C, and certain cancers. There can be no duplication of information across the registries.
This next objective is called electronic reportable laboratory results. The larger labs already have systems that report directly to public health registries when reportable conditions are identified. The EHR technology must be HL7 or Health Level 7 version, and the state must be able to receive it. The system must be secure and the labs translated into code. A lot of work still needs to be done in this area because of limited staff resources. Laboratories may need additional resources, i.e. technical expertise and increased staff time to create a smooth interface and workflow.